Hi everyone, this is Jennifer. I am one of the CMAs for the NCCAA Health staff. In today's discussion, we will be going over seizures. We will discuss the importance of seizures, signs and symptoms, triggers, and medication. What is a seizure? A seizure is a sudden surge of electrical activity in the brain, usually affects how a person appears or acts for a short period of time. Seizures are idiopathic, meaning the cause is unknown. A trigger is something that occurs fairly consistently before seizures and more often than by chance. Some common triggers include specific time of day or night, sleep deprivation, overtired, not sleeping well, not getting enough sleep, fevers or other illnesses, flashing bright lights or patterns, alcohol or drug use, stress, menstrual cycle, or other hormonal changes, not eating well, low blood sugar, specific foods, excess caffeine, or other products that may aggravate seizures, certain use of medications. Some frequently asked questions. You can swallow your tongue. You cannot swallow your tongue during a seizure. It is physically impossible. Should something be put in the mouth to prevent them from biting their tongue? No, absolutely nothing should be placed in the mouth during a seizure. It can actually do more harm. You can chip teeth, cut gums, or even break their jaw. If my friend has seizures, can I get them? Seizures are not contagious. We will be going over two different types of seizures. Absence seizures. They can cause rapid blinking and staring into space. The tonic-clonic seizures can make a person cry out, lose consciousness, fall to the ground, have muscle jerks or spasms, sometimes even lose control of their bowels. We will be learning about seizure first aid. A good way to remember seizure first aid is with stay safe side. Step number 1, stay with the person until they are awake and alert after the seizure. Time the seizure, remain calm, and check for medical ID. Number 2, keep the person safe. Move or guide away from harm. Number 3, turn the person on their side if they are not awake and aware. Keep an airway clear. Loosen tight clothing around the neck. Put something small and soft under their head. Call 911. Do not restrain. Do not put any objects in the mouth. Rescue medications can be given. Next, we're going to watch a video on seizure first aid.
Guys, give us some room. He's having a seizure.
Get me some towels.
Okay. Stay calm. It's going to be fine. Help me get him on his side. All right, listen up, fellas. Before we practice, I want to go over a couple of things. First, I'd like to welcome back Michael. Good to have you back. We all know Michael has epilepsy, and he shared his seizure with us in the game. He has something he wants to say.
Yeah, thank you all for supporting me, and thanks to Coach for knowing what to do. I'm sorry if my seizure scared you guys. It could be scary for me too. But what's even more scary is if people didn't know what to do.
So today, we are going to learn seizure first aid thanks to the Epilepsy Foundation. We're teammates, right? We take care of one another, we count on one another, and when anyone with epilepsy has a seizure in front of you, they're your teammate, and they're counting on you. So, First, stay with him. Okay, stay calm and keep others around you calm and out of the way. Protect him, keep him safe. It's also important to remember that the person having the seizure should be lying down and that there is nothing harmful in their way. Turn them on their side and support their head so that they're not banging it and so they don't choke. Never put anything in their mouths and do not hold them down. Time the seizure till the very end. Okay? Knowing how long the seizure lasts is important information for the doctors to know. If the seizure lasts more than 5 minutes, call 911. When you see somebody having a seizure, you're going to feel a little powerless. But if you protect them and if you stick with them by their side, you're doing the right thing. Okay? All right, let's practice this.
Bulldogs on 3. 1, 2, 3. Bulldogs!
Let's go.
Medication, if prescribed by a physician, could be the Diastat Acutiol diazepam rectal gel. This is a medication for patients 2 years of age and older who require occasional use of diazepam to control bouts of increased seizure activity or prolonged breakthrough seizures. The health staff will conduct center-level training as needed for administration of Diastat if prescribed by physician. A few things to remember: do not administer expired medications. Check the child's IHCP seizure action plan. Follow doctor's orders. Check the 5 R's. Right child, right medication, right dose, right route, right time. Also, right documentation. Make sure your documentation is thorough. Call 911. In case of an emergency, always call 911. Here are the resources used for this presentation: Epilepsy Foundation, Center for Disease Control and Prevention, and Diastat Acutiol diazepam. Okay, time for post-test questions. True or false? Do not place anything in the mouth during a seizure. This is true. Number 2, true or false? Seizures are contagious. This is false. Number 3, true or false? The 3 steps in seizure first aid are stay, safe, and side. This is true. This has concluded the presentation. Thank you for watching.